Hello, everyone, and welcome to our December seminar of the Global and Community Health Seminar Series. I'm Christine Reedy. I'm stepping in for Jane Barrow, who is the Director of the Office of Global and Community Health, and I'll be introducing our guest speaker today. We have with us Dr. Samantha Jordan. Samantha, Dr. Jordan is a longtime friend of HSDM. She is currently the Oral Health Director at Healthcare for All and an instructor part-time at the Harvard School of Dental Medicine. Dr. Jordan is a board-certified dental public health specialist with clinical experience in community health centers and private practice. And her work has focused on advancing oral health equity through health policy and advocacy, with efforts aimed at improving the Massachusetts health system to reflect the reality that oral health is essential to overall health and well-being. Dr. Jordan practices as a general dentist at the Alliance Dental Center in Quincy, Massachusetts. Prior to her current roles, she has served as the chief of dental at Lowell Community Health Center in Lowell, Massachusetts. And as chief, she sought to leverage the unique potential of community health centers to promote oral health equity and develop best practices for oral health integration. And during her time, she launched an integrated oral health program, including the construction of a 13-chair dental clinic. Dr. Jordan earned her DMD from Tufts University School of Medicine, an MPH from the Harvard T.H. Chan School of Public Health, and a certificate in dental public health from the Harvard School of Dental Medicine. In addition, she trained at the National Institutes of Health as a Howard Hughes Medical Institute Research Fellow. Today, Dr. Jordan will discuss the importance of working with advocacy groups to understand challenges and then create and disseminate evidence to address these challenges faced by our communities across Massachusetts. So welcome, Dr. Jordan. And Dr. Jordan has said that she is willing to take questions during her presentation, but we will also have the availability for questions at the end that you can submit either through the chat box function or the Q&A. And so I will turn it over to Dr. Jordan.
Great, and thank you so much for that warm welcome. And thank you to the Office of Global and Community Health for inviting me to present today. And thank you to all of you for joining us to learn about oral health advocacy in Massachusetts. I think that Christine gave a really lovely and thorough introduction about who I am. And again, what we'll be talking about is the work that I do with Healthcare for All as their oral health director and working with communities in Massachusetts around oral health advocacy. So Healthcare for All is a long-standing consumer advocacy organization here in Massachusetts. And Healthcare for All advocates for health justice in Massachusetts by working to promote health equity and ensure coverage and access for all, including for oral health. And our three main lines of work include direct service through our multilingual consumer helpline, community engagement through our outreach and organizing teams, and advancing policy through our advocacy and coalitions. And I wanted to start first by level setting what we're talking about when we talk about health justice. And I think what's important is to kind of talk about what's the differences between equality, equity, and justice. And when we talk about inequality, what we're talking about is the unequal access to opportunities. And with equality, we're talking about the same tools and assistance being applied. And you can see in this illustration how equality doesn't necessarily mean that people are able to better access what they need. And with equity, we're talking about custom tools that identify and address the inequality. So we can see with equity, there's different tools, in this case, different size ladders that help people to access what they need. And then with justice, that's where we're talking about actually fixing the system to offer equal access and equal tools and opportunities. And so when we think about health justice, what we're really thinking about is everyone having the opportunity to access the health care that works the best for them, and that everyone has the opportunity to be as healthy as possible. And oral health is a health justice issue. And Healthcare for All recognizes this truth, and that's why oral health is an important part of our work. There is a book called Teeth, and it's written by the journalist Mary Otto, and it's a very thoughtful, detailed account of the complexities of the oral health system in America. And if you haven't read it, I highly recommend it. And in the book, Mary Otto writes, "There is no shame worse than having poor teeth in a rich world." And I think that's a nice summation of why oral health is a health justice issue. Another nice way to think about oral health with a justice and equity lens is to think about oral health access as a series of doors. And accessing good oral health, it's like going through a series of locked doors. And the doors open up to systemic factors that influence oral health, such as fluoridated water, healthy, nutritious foods, insurance that includes dental benefits, and providers who accept different kinds of health insurance. And some people have all of the keys that they need to unlock the doors to oral health, and there are others who may be missing some of those keys. And so in order to build a healthier state, in order to make Massachusetts better, we need to make sure that people have the keys to accessing good oral health. And that is what a just oral health system looks like. So I want to start by also just giving some information about what we know about Massachusetts. We know that even though oral health is improving nationally, many people still suffer from chronic oral conditions and lack access to the dental care that they need. And in Massachusetts, studies have found that there are high levels of unmet dental need. So 23% of school children had untreated decay. We saw that low-income adults are 5 times more likely to be missing 6 or more teeth. And almost 60% of seniors in long-term care facilities had untreated dental decay. And consistent across these different studies, what we've seen is higher levels of dental decay and missing teeth for people of color and low-income individuals. And what we know is that the burden of oral disease disproportionately affects children that live in poverty, racial and ethnic minorities, frail elderly, and other socially marginalized groups, such as immigrant populations. And what we're also learning is about how the pandemic has worsened dental access disparities. So in this data that has been recently shared from the Department of Public Health's Office of Oral Health, we're looking at how COVID has affected access for Mass Health members with intellectual and developmental disabilities. And what we know is that individuals with special healthcare needs not only have a high level of oral disease, but they also face the greatest barriers to accessing preventive and routine care. And what this data is showing is it's using the behavioral management code as a proxy for access to dental care for this population. And what you can see is that during COVID, it drops dramatically. The size of the bubble and where it is a lot lower. And we've seen it recover. So it's coming up, it's getting a little bit bigger, it's getting a little bit higher, but it's nowhere near the previous levels. And when Massachusetts residents are asked why they're not able to visit the dentist, cost is the most common reason that's given. And cost is the main barrier to dental care across the US. And this is true for all incomes, for all ages, and regardless of insurance status. And what we also know is that dental care is consistently the most common unmet healthcare need among Massachusetts residents. And we can see in this graph, it's showing that of the respondents to this survey, almost 20% reported having an unmet dental care need. And you can see that that bar is a lot higher than even for specialist visits, vision care, and prescription drugs. And what we know is that the lack of access to dental care, it continues to be a barrier to good oral health, especially among poor and rural communities. And this has led to the increased use of emergency departments for preventable dental care. And most emergency department dental visits are only able to provide pain management, and they do not resolve the actual problem. Which often means that people who use the ED for dental care end up needing to return, and ultimately they still need to see a dentist to resolve their problem. What we know is that improved access to routine preventive dental care can improve people's health and well-being, and it can also reduce treatment costs and appropriately use healthcare resources. And it avoids expensive, ineffective emergency department visits for preventable dental diseases. So what is Healthcare for All's approach to addressing these oral health issues in Massachusetts? And our Oral Health Coalition is really the foundation of our oral health work. So our statewide Oral Health Coalition is called the Oral Health Advocacy Task Force. It's also known as OHAT, and its members include consumers, advocates, healthcare professionals, academics, and insurers. And OHAT has been, this is actually the 20th anniversary this year, and it was created in 2002 in response to state budget cuts to the Mass Health dental program. And the mission of OHAT is to improve oral health for all persons in Massachusetts. Our policy priorities include increasing awareness of the importance of oral health and the need for community solutions, increasing access to care for children and adults enrolled in Mass Health, strengthening and expanding the capacity of the safety net dental program, and protecting funding for essential oral health programs in the state budget, and integrating medical and dental care. So our strategies, it includes promoting specific legislation and regulation changes, using a social and racial justice lens, advocating for funding and programmatic improvements in the state budget, and we work really closely with the Legislative Oral Health Caucus. So not every state has a Legislative Oral Health Caucus. This is one of the many things that makes Massachusetts unique and very well positioned to make great improvements to our oral health system. The Legislative Oral Health Caucus was formed in 2005 by Massachusetts Senator Harriet Chandler. She's been a long-standing champion of oral health in our state. And the caucus was formed to organize support in the state legislature for Medicaid dental benefits, and to spur legislation and funding allocations for oral health, and to improve the quality of oral health policy debate and discussion in the state. And really, what it was that there was a vacuum and there was a need for oral health expertise and information for state legislators. And Senator Chandler is actually retiring, so we'll be helping to see the Oral Health Caucus transition to a new champion. And we're just incredibly grateful for her work throughout the years, and are looking forward to continuing to work with the Legislative Oral Health Caucus on important policy measures. Our work, so we work with the Legislative Oral Health Caucus, and then we also work through other official channels. So we'll engage with state officials and policymakers. These can be through one-on-one meetings. Sometimes Healthcare for All will set up a legislative briefing. We recently did we called it a Healthcare Academy, a 101 for state legislators who are interested in learning more specifically around healthcare policy. We also participate in official meetings and committees and provide comments and feedback and input whenever there's the opportunity. Grassroots advocacy is a big part of our work. So we keep our coalition members up to date with different advocacy opportunities. We'll send out advocacy alerts encouraging members to reach out to policymakers. We work to try to make it as easy as possible for people to educate policymakers by developing templates, written scripts, and giving talking points so that people can just use that information, tailor it to their own experience or perspective, and start talking with the policymakers. And then we also help to work with coalition members to develop blog posts when we think it would be effective, maybe writing an op-ed or a letter to the editor. And our work is really centered around community. And some of the ways that we make sure that our work is relevant and meaningful for community members. So one is our helpline. So I'd mentioned before that we have direct service, which is our consumer helpline. That is a number that consumers will call when they're having difficulty accessing coverage or trouble getting healthcare that they need. And mostly people are using it for medical coverage, but we do have people who will call it for oral health challenges, trouble finding a dentist. And so we do get information from our helpline in terms of what consumers are having challenges accessing. And then we also set up some intentional community listening sessions as well. And we hold them in different communities. In the past, we've had it in the weekends or after work. They can be in person or virtual. And in the past, we've been able to make sure that they include food and compensation, and to make sure also that we provide space for childcare to try to get people to basically to lower the barriers to participating and to try to get as many community members' voices heard as possible. And part of our work too is story banking. And stories are so important to moving policies forward. What we see is that data is important, but it's really the combination of data and stories that move policies forward and are able to get traction and to really make a difference. And what stories do is they help to make complex policies easier to understand and communicate. And it really helps to connect with policymakers, other consumers, and with communities as well. We also provide direct outreach and technical assistance. So for example, we'll work with the accountable care organizations, the ACOs, to help them with oral health integration, and can offer a basic framework for what oral health integration in primary care settings look like, and to offer recommendations and resources. And then lastly, we'll also provide public-facing communications. So again, like we might organize a press conference, help develop op-eds, we might put together policy briefs, or consumer flyers as well, and offering those in different languages so that they can be accessible to different communities. And you know, what we've seen is that our kind of incremental approach, taking these different strategies and making sure that we are community centered and lifting up the community voice, and taking these different strategies, you know, we've seen some really good success. And in January of 2021, we were excited to see that MassHealth restored the full adult dental benefits. And that was really the result of, you know, over a decade of advocacy, and to make sure that legislators understood the importance of adult Medicaid dental benefits. We also recently were able to get an oral health special commission included in the state budget, and have been working to make sure that the 1115 Medicaid waiver that was recently approved by CMS at the beginning of this fall includes oral health integration provisions. So with the MassHealth adult dental benefits, what we've seen is that starting in January, the comprehensive dental benefits for MassHealth adults were restored. This is an investment of over $39 million annually. And what we've learned from the MassHealth program is that over 63,000 MassHealth members received one or more of the restored dental services in 2021 alone. And I guess one more thing I'll say before we talk about the special commission is that we do know that there's more work to be done to make sure that members understand what their dental benefits are, and to make sure that providers are informed as well. And so this getting the MassHealth dental benefits restored was a great step. We want to make sure that that information is getting out to the public. And we also want to make sure that we're protecting them as well. With the Oral Health Special Commission, it's been a long time since the Massachusetts has had a special commission that looked specifically at the state of oral health in Massachusetts. And what the Oral Health Special Commission is tasked with doing is it's tasked with conducting a statewide oral health needs assessment, and will specifically to look at gaps in oral health access across diverse groups and ages. So I shared with you some data points earlier about what we know about MassHealth or about Massachusetts. And that data, although it's helpful, it's outdated, and we really need more information to know what are the appropriate steps that we need to take to make sure that more people are able to access the oral health care that they need. The Special Commission, in addition to conducting the statewide oral health needs assessment, will then prioritize actionable recommendations. So using that data, that updated information, to see what is needed to be done to increase access to dental services and address oral health disparities. And then also to be developing a long-term oral health surveillance plan to ensure that we have continued monitoring of trends in the state. And throughout the process, we felt that it was really important to make sure that a broad set of diverse stakeholders are represented and engaged through the special commission. And as we have looked at the upcoming legislative session, so in Massachusetts, we have a 2-year legislative session, and we recently finished one. So the next session will be starting in January 2023. It'll go through December 2024. And we've been thinking about what our policy priorities need to be for this upcoming session. And we came up with our proposals by taking in information from the community, again, listening to what we were hearing on our helpline, taking in what we learned from the different community listening sessions, from our coalition members and the community-based organizations that they represent, and then also talking with the experts who are represented in our coalition and thought leaders to develop our policy priorities. And one of the things that we have heard is that it can be challenging for Mass Health patients to find a dentist who accepts their insurance. And so one of the things that we're thinking about in this coming session is how we can help to increase dentist participation in Mass Health. And we're looking at, could we create some incentives for communities with a high number of Mass Health patients, but low dental utilizations? And, might this be effective in increasing that utilization in those communities? We're also looking at Mass Health benefit education for community members and providers, in partnering with community-based organizations to make sure that people, again, are aware of their Mass Health dental benefits, especially for adults who may not be aware of what's all the services that have been restored. And what we hear a lot from our helpline is that language access and culturally responsive care is something that is needed. And for our patients who are best served, or our consumers that are best served in a language other than English, it can be very challenging to find a provider who will see them. And so we know that that is a priority from our consumers. And we also know that oral health integration is an important opportunity and something that we need to continue to make sure is raised as an important strategy when we think about opportunities to improve our healthcare system. I mentioned that we are also thinking about how we need to be protecting the Mass Health adult dental benefits. We do know that it tends to be a pendulum where the dental benefits, when the state budget is tighter and they're looking for places to make cuts, because Medicaid adult dental benefits are not required at the federal level, that is often a place that is at risk for being cut in state budgets. And we know how important the restored adult dental benefits are to our Mass Health members. And we are working to proactively protect those benefits. And one of the ways in which we're doing that is we're trying to collect stories from providers and consumers that help to demonstrate why it is so important And so that way we can be prepared to speak with legislators and policymakers with specific stories that show how important it is to continue to invest in the adult dental benefits. So when you think about how you can get involved, an easy way is to join our oral health advocacy task force. There is also the Better Oral Health for Massachusetts Coalition, also known as BOMAC. I would encourage you to get involved. And if you are planning to be in another state, you can also connect with the American Network of Oral Health Coalitions to get connected with a coalition in the state that you are in. And then also, I'd encourage you to connect with national organizations to learn and assist in their advocacy agendas as well. There's the Oral Health Progress and Equity Network, also known as OPEN, the National Network for Oral Health Access, also known as NOAA, the CareQuest Institute for Oral Health, Families USA, and there's a lot more as well. And I think this is like a nice way to show that there's different ways to be engaged. And what you see is that at the base, it's just being aware. And for a lot of people, this is, as much as they're able to be involved in advocacy. And I think if that's what you're able to do that. And that can be, again, is as simple as just joining a coalition. You sign up for a newsletter, you subscribe to updates, you're following on social media, you're just aware of what is happening around oral health advocacy. And then if you have more interest, if you have more bandwidth, then you can actually start to follow. And that might mean actually attending a coalition meeting. You're not just subscribing to the newsletter, you're actually reading it. Maybe there are some advocacy alerts that you're able to respond to. And then, even just liking, commenting, or sharing social media posts are helpful as well. And then as your interest grows, if you have more capacity, you can actually start to contribute to advocacy as well. You can contribute time or money. You can attend a lobby day, start to share your story. We know how powerful and important stories are. And then also help us connect with consumers as well, who might be willing or interested to tell their story. And then as we go further, we get to committing. And so this is really investing in the mission and the success. This is where we're talking about being willing to call or contact legislators. Maybe you write a blog post, write a letter to the editor, and actually start sharing information with others in your own network. And then at the top, we're talking about actually leading oral health advocacy. So this is where you're actually serving as a decision maker, you're a thought leader, you're helping to kind of come up with what are the policies, what are the solutions. You might be willing to testify, again, maybe join a meeting with a state legislator. And again, encouraging others to join and to participate, and then maybe even writing an op-ed or participating in other media. And what you can see is that with the increasing involvement, you're having more influence in the advocacy and the policies. And what we also know is that people kind of go back and forth. So it's not necessarily linear. There might be times where you have more or less bandwidth or capacity. And so people will go kind of back and forth throughout. But I encourage you to at least start with being aware. And another thing I'll leave you with is just a reminder, when the ADA's ethics and code of professional conduct, it includes the qualities that is expected of dentists. And what we know is that, it says that each dentist should share in providing advocacy to and care of the underserved. And the ethical dentist strives to do that which is right and good. So thank you. This is the team at Healthcare for All. This is my presentation, but I'm happy to answer questions and to have a discussion. And I think we see that there are some questions. And please feel free to reach out. I'd be happy to talk with any and all of you.
Thank you so much, Dr. Jordan. This was a really helpful presentation in terms of thinking about what you're doing at Healthcare for All, as well as what is happening around the state. And we're really excited about the Oral Health Special Commission and what is going to come out of that. So we have some questions and a comment, and actually I'll start with the comment first from Dr. Len Brennan, who said that it was an excellent presentation and material, and thank you very much. And to also thank you for the work that you do with the populations that you serve. And Len actually had a specific question around serving older adults. And the question is, how has ageism affected dental health care for older adults in terms of prevention, management, rational treatment planning, and treatment? And any thought on how to change the culture on how we view seniors and their healthcare needs?
It's such a great question. And, Dr. Brennan, I would almost turn it around to you and look to you as a thought leader as to what we could do to make a difference. I do know that, at Healthcare for All, and this is before I had joined the team, we've done listening sessions specifically with older adults in the Massachusetts Senior Action Committee. And what we heard is that people, and what we know too, is that for older adults, dental benefits are not part of Medicare. And because that's not the case, what we see is that the access to oral health care, the disparities between low income and high income older adults has widened for older adults, and we've seen it decrease in other ages. And we also know that there's more older adults, more people who are keeping their teeth. There's more need for oral health care. We need to be thinking more about how we can help older adults get the coverage that they need and access the care that they need. And I think there's actually some really great work that's being done, even at HSDM. I think the work that's being done for like mobile oral health care that's aimed at seniors is really important in helping to make sure that people are able to access care, where not necessarily at a traditional dental clinic, but maybe it's at the senior center. It could be, even at their own home. And just recognizing that there are some different needs that come for older adults. But that is certainly a population that we know has, especially for the older adults who are frail, who are in nursing homes or assisted living facilities, that may have mobility issues getting to a dental clinic, that there's a lot of work to be done. And please, Dr. Brennan, if you have insight, please feel free to share that out with the group as well.
So thank you, Sam. Along the topic of ageism, we had a question from Helene Bednarsh about ageism also in terms of finance and whether you had any comments about that.
And Helene, maybe you can add a little bit more there. I will. So a lot of what we see is that for older adults, because they are more likely to have Medicare coverage, which again does not include dental routine preventive dental care in the regular Medicare, the standard Medicare plan. That means that a lot more older adults are going to be paying out of pocket. And so the cost barriers are higher for older adults. And if you had more that you wanted to talk about there, please feel free to add more, and I'm happy to talk more.
So just to follow up, so for example, those who have Medicare dental, hard to find a provider and many services not covered.
Mm-hmm. Yeah, and I will say, so the kind of standard Medicare plan does not include dental. There are these Medicare Advantage plans. So this is like a privatized version of Medicare, and they will often use dental benefits as a way, almost as like marketing, to try to get people to sign up for their specific plans. But what we've heard from consumers is that even when they have dental coverage through the Medicare Advantage plans, sometimes the networks are not adequate, and the coverage can be very variable in terms of how much their out-of-pocket cost is, what's actually included in the benefits.
Great, thank you. So we have a couple of questions about, excuse me, related to the Oral Health Special Commission, as well as some of the various advocacy organizations. So I'll start with Dr. Donoff had asked, who are the members of the Special Commission, and have you ever presented to the Mass Medical Society Committee on Oral Health?
Great question. So the Special Commission, there will need to be appointed and have their initial plan filed with the legislature by the end of July. It seems unlikely that the members of the commission will be appointed before the new governor takes effect. What we're hoping is that it'll be a priority, and so we want to make sure that the governor appointees happens early in the new governorship. And the outside section of the budget that establishes the Special Commission is clear about kind of who's included in who needs to be represented in the Special Commission. And so it does, for example, include the Office of Oral Health's Advisory Committee. Any members of that committee are included. So if you look on there, it can specify, and I'm happy to share with you as well. And the Mass Medical Society actually supported the inclusion and helped to make sure that the Special Commission moved forward. But that's a good reminder that we should, now that the Special Commission has been established, come back to the Mass Medical Society's section on oral health and make sure that they kind of know about the next steps and kind of stay on top of the process. Because what we have seen happen before is that you can have a commission that is technically established, but if the members are not actually appointed, if there's no members, there's no actual work that's being done. So your point is really a good one, which is that it's not just about establishing the commission, it's about actually making sure that the work is done.
Yeah, so that's, I think you had saw Helene's comment about in terms of the Special Commission, designated follow-up steps, and that should be a priority. So,
definitely.
And then Catherine Hayes also shared with respect to speaking about older adults that MassHealth has a very generous senior care option, SCO, with comprehensive dental coverage. So our state actually is much better than some other states.
And that's true. And I'll say, kind of not the same as like the Medicare Advantage plans, but the SCO plans can also be, they'll offer at least the MassHealth, like adult dental benefit coverage, but then they can also offer some additional coverage as well. And so there are some SCO plans that even have an implant benefit, which is like, you don't usually even see in the private dental benefit plans. And it's very specific, it's limited, and similar to the Medicare Advantage, it can be a way to market and to try to get people to come into the SCO plans.
Excellent. So I do want to slip a question in here, and actually, Jane, if you wanted to come off mute and ask your question about the Medicaid waiver, or I can ask it for you. We'd rather hear from you.
Thank you, Dr. Reedy. Dr. Jordan, great to see you as always. Fantastic presentation. As I've been listening to you speak about some of the challenges, I'm curious as to your thoughts on the Medicaid waiver for ACOs that will introduce a dental quality metric in the very near future. We're only a couple of months away, a couple of weeks away. Do you see that as a mechanism that can help lead to greater adoption of integrated medical dental care and perhaps help providers have greater awareness of some of these benefits that their patients may actually have? Thank you.
Great question. And yes, that's my quick answer. And I will just share for others who may not be aware of what the 1115 Medicaid waiver is. Basically what it means is that, so the Medicaid program, it is a joint program that's administered with the federal government and with the state government. And because it's a joint program, there are federal requirements for what the Medicaid program has to include. So for example, pediatric Medicaid dental benefits required, adult dental Medicaid benefits not required. That's why the adult dental Medicaid benefits can be on the chopping block when the state is looking to tighten up its budget. What an 1115 waiver does is it allows a state to make some changes beyond what the federal requirements are. So it's a way to say, we want to try something different. We want to be innovative. And we want to do some things that normally wouldn't be allowed through the traditional Medicaid program. And in Massachusetts, the MassHealth program created the accountable care organizations. So really made a big restructuring to the way that the Medicaid program is run. So it's more of a value-based system. And what Jane is bringing up is the oral health components that are part of the 1115 waiver. And so that includes a fluoride varnish utilization metric for primary care providers, which I think is a great opportunity to promote and advance oral health integration in the primary care setting. The other thing I'll just add that we're really excited about is there's a new way in which primary care providers are paid. And what it means is that there are certain requirements that primary care providers must meet, and then they can go above and beyond and receive additional funds if they meet these additional tier requirements. A baseline tier requirement, meaning that all primary care providers in the ACO program have to include an oral health screening for all members. So not just for pediatric patients, but for all of the members. And I think that is another exciting opportunity to advance oral health integration through the Medicaid 1115 waiver.
Great, thank you. And actually, I see another question that you have in here, Jane, and I don't know if Sam had answered it, but I'll just ask again. In terms of, will our expanded dental package and Medicaid be at risk when public health emergency dollars go away, as what happened in 2000 and
Yeah, I think that's a great question. And what I will say is that certainly with the pandemic, what we saw were that state budgets were healthier. There was more dollars that states had, including Massachusetts. And not just because of the public health emergency ending, but also just with like economic realities. What we will see is there will be a time where there was not going to be, basically the state will not be as flush with cash. And that's where decisions are made about how to allocate resources, where are cuts going to be made. And that's where we really do need to be, because the adult dental benefits are not a federal mandate for the Medicaid program. That's why it's at risk. And that's where it is very common for legislators to, when they're looking for where they can save money in the state budget, they will go to adult Medicaid benefits. And so again, we want to be really proactive in making sure that legislators and policymakers understand that it's an investment that's important to keep, because it saves money for the state overall, because there's going to be oral health problems that come up. And again, like the costly and inexpensive and ineffective use of emergency departments for dental services, the state would have to pay for that regardless, and it would be a much more effective and useful way to spend our state dollars to continue to invest in the adult dental Medicaid benefits. And so we know that that's a case that we're going to need to continue to be making, and we want to be prepared for.
Great, thank you. So we have a few minutes left, and I did want to interject. We had a couple of questions from, I believe, dental students. And so just thinking about engaging with the next generation. One question was whether dental students in Massachusetts can join the coalition, and another question around opportunities for motivated undergraduate students to get involved in policy research and advocacy in the Boston area. So if you could say a little bit about opportunities.
Yes, I mean, I'll say dental students can join, undergraduates can join, like any consumers, any members are welcome to join the coalition. And again, thinking of that pyramid, it starts with just being aware, kind of hearing about what's going on, and then you can kind of become more involved as your interest and your capacity increases. And I will say, so for example, at Healthcare for All, we have MPH practicum student who's working with us, helping us to develop our legislative work, doing some policy analysis that can involve looking at bills in other states, trying to see what are the things that we could bring to Massachusetts. Oftentimes it's doing research where, so you find a bill and then you try to find out, okay, who's the person who introduced that bill in the other state? Who was the coalition that was involved with it? So it's fun to do some policy research to see kind of what's being done in other states. And we've had students that have been very helpful in helping us to develop our policy ideas. And we do sometimes have undergraduates too that will come, and sometimes it's just spending a day shadowing at the Healthcare for All office. And other times, we might be able to set up like an internship where you're spending a little bit more time. But definitely a range of different opportunities. And I'd encourage anyone who's interested to join the coalition, and then feel free to reach out to me, and I'm happy to connect with you and talk about different opportunities as well.
Fantastic. So thank you. And yes, we can share Dr. Jordan's contact information for anyone who would like it. We did have a couple of questions, one from I believe an undergraduate student interjecting about what we saw on our ballot in Massachusetts, and on question 2. And I do want to ask a question from Elizabeth Alpert, Dr. Alpert, around any concerns for unintended consequences on oral health quality, equity, or justice with the passage of question 2.
Yeah, a very timely and like great question. So for those who maybe are not aware, the question 2 was a ballot initiative that just recently passed in Massachusetts that sets a medical loss ratio for dental benefit plans. And basically what a medical loss ratio is it specifies the amount of premium dollars that need to be spent on patients. And this is something that with the ACA, it applied to medical plans, and dental benefit plans were carved out of that requirement. And so Massachusetts is the first in the US that has actually set a specific medical loss ratio limit. It's 83%. So that means that for every dollar in premiums, 83 cents must be spent on patients. And what I will say is that when we had looked at the ballot measure, we found that it wasn't really about consumers, and it wasn't about consumers being able to access better care. And for us, we thought it was, we wanted to make sure that there was an appreciation and recognition that cost is a big barrier for consumers and accessing dental care. And one of the things that we think would be important is when we look at the new medical loss ratio. So one, I'll just say that we think that the financial transparency and the accountability, that's important, and it should apply to medical plans, and it should also apply to dental benefit plans. But that we think that there should also be consideration for the impact on consumers, and to specifically look at, what will be the impact on consumers' out-of-pocket costs and coverage. And so there's more work to be done. But we do recognize that the ballot, it wasn't designed for consumers and helping consumers access care. So we think that there might be some tweaks that would be important, that would add a consumer focus to it, but that ultimately it's not really about consumers accessing care. I hope that's helpful.
Great, thank you, Dr. Jordan. So we have 1 minute, and I just want to mention something that Helene mentioned, and with a list of advocacy groups that you had mentioned, including Families USA, she had asked about, would the American Institute of Dental Public Health also go up in that list as well? So I just wanted to
Helene,
mention
thank
that.
you for including. Yeah, the AIDPH, they're doing some really wonderful work. Thank you for including. I should have listed them. There's a ton of organizations that are doing some really great work, but certainly AIDPH is top of the list. Thank you.
Great. Thank you so much, Dr. Jordan, for providing your presentation today. It was great to hear about all of the work that Healthcare for All is doing with respect to oral health in the state. And we look forward to hearing more about some of the things that you're doing, and how we can all get engaged in this really important work of yours. So thank you so much. And
wonderful. Thank you for the opportunity. Looking forward to connecting with everyone.
Excellent. And on behalf of OGCH, thank you everyone for attending, and we look forward to seeing you in the next seminar series in 2023.